As we've been telling you, the healthcare industry continues to deal with a worker shortage, compounded now by the vaccine mandate.
Spectrum News 1 reporter Wendy Wright is telling us about one part of the healthcare industry not yet mandated to get the COVID vaccine, but still struggling to find employees.
Living here is really been amazing for me.
Karen Balsh lives here at this DePaul Property Zone building in Rochester. The nonprofit organization has been in Rochester for more than 60 years, focusing on providing housing for people with special needs, ranging from addiction to mental illness.
I have all of the privileges of living on my own, but there is also a great team of people that when I'm having a bad day, when some of my personal symptoms are rearing their head beyond what I've learned to control, I can get a hold of one of them 24/7 just by coming down a few floors in the building and can have someone to talk to.
Karen is one of the many residents here receiving on-site services.
So really, what our staff's role is to know resources in the community and assist them to access those services in the community, which will then help them prevent homelessness and live as independently as possible, as long as possible.
DePaul Vice President Gillian Condi says the biggest problem facing the organization now is a staffing shortage.
Well, one of the things that's difficult in mental health housing specifically is, of course, wages. And that's our biggest challenge, is to get people in the door because the wages continue to be low.
Like much of the rest of the healthcare industry, DePaul was already short-staffed heading into the pandemic, followed by COVID and then unemployment payments. And now the mental health industry is preparing to be added, possibly, to the vaccine mandate list.
And what ends up happening is you end up having staff that are committed, exhausted and tired. And so the more that we can bring in new people to help offset that, the better.
Karen offers her own job description for anyone considering working at DePaul.
From my angle, your personality is a lot of what matters. And if you have a heart to truly help people, that's all you need. You've got to have the paperwork skills that any business like this would have. But we don't expect you to be moving mountains. Just be there walking alongside of us as we face them.
Condi encourages people to consider not-for-profit work, which she describes as meaningful and fulfilling. In Rochester, Wendy Wright, Spectrum News.